Hello, my name is Deborah Ray. I work for ChristianaCare Health System located in Newark, Delaware. I am excited to spend a few minutes with you to talk about trusting relationships in supply chain. Before I do that, let me tell you a little bit about myself. I have 25 plus years of experience in healthcare. I am one of your ARM board representatives, and I have worked in several leadership positions throughout my career. All supply chain professionals, directly and indirectly, play a very important role in the quality of care received by the patient. The 10 Commandments are just a few reminders about trusting relationships in supply chain. A more detailed article was published and can be found in Supply Chain Strategy and Solutions, the March-April edition 2016. The 10 Commandments are: be yourself and yet professional. Understand your customer. Be courteous. Know how to listen. Supplier added values. Provider engagement. Collaborative efforts between suppliers and providers. Follow through. Develop mutual trust. And expertise is essential. Most of these, if you think about it, are common sense. They're really daily reminders. Respect one another. Sometimes you just need to slow down, take a break, and remember what the common denominator is: trust and the patient. We all want a paycheck at the end of the day in healthcare, but it's really more important, and you need to focus on the outcomes, and that being quality patient care. Whether you believe it or not, we all play a very active role in the success and satisfaction of the quality of care the person perceives, receives, and is shown in reports that we all now have access to. Hold yourself accountable, just as you would hold the other person accountable. Trust is a give and take. It is mutual respect for one another, but it's also shown through your values, actions, and behaviors. Be yourself and yet professional. Understand and know what you are talking about. Know your customer. Know your product. And as a provider, know your supplier. Have a basic knowledge of the product and or services to be discussed and what your goal is. What do you want to achieve in this meeting? Don't be afraid to ask questions. Get clarifications. Even more importantly, don't be looking at your computer. Don't be looking at your cell phone. Set the stage up front if you were busy. Minimize the chit-chat. Respect that they took the time and have something very beneficial to offer. Even on the phone, you can always tell if the person on the other end is listening. So take a minute and listen, or be upfront and say, this is not a good time to talk. Knowing how to listen is very critical. Don't assume you already have the answer. I heard once, listening is a very vital and frequently underutilized leadership tool. Decades ago, a study found that a typical person forgets about half of what people say as soon as they finish saying it. We are increasingly distracted by our busy schedules and the technology we think we cannot live without. Let's minimize that and prioritize listening. Make eye contact. Create time in your day for reflection, and reflect on a meeting or a conversation that you had, and be prepared for the next one. Always ask questions. Be certain you understand whatever it is that is being discussed, whatever the case may be, because if you are not listening, you are missing out. And rework is very costly and very time-consuming. Collaborative efforts between suppliers and providers is essential these days. Allow the supplier, whom has the expertise, to explain his or her products and services. Make sure there is follow-up and open communication. Make sure they are working with the correct people, and make sure you have assembled the correct team. Neither party should backdoor the other. When suppliers and providers work together, mutual trust is almost immediately established. If you are loyal and trustworthy and are focused on the bigger picture, it is an all-round win-win. The patient wins, the organization wins, and you can feel confident about the job you performed. The bottom line, we all play a role in healthcare, so let's work together. Thank you.